Hi, I'm Heidi Toby, Director of Social Work Programs at Therapist Development Center. If you're a first-time viewer and looking to pass your social work or MFT licensing exam, or just interested in topics relevant to clinical social work and psychotherapy, you've come to the right place. If you like it, be sure to subscribe for updates. You can also sign up for our complete LMSW, LCSW, and MFT exam prep programs by going to our website at therapistdevelopmentcenter.com or click on our logo. Today's topic, bipolar disorder recall. This month, we're continuing our series comparing recall versus reasoning questions. Every 2 months, we're taking a topic that could show up on the ASWB exams and are first doing a recall or application question on the topic. Then the next month, we come back with a reasoning-based question on that same topic. In February and March, we covered narcissistic personality disorder. In April and May, we covered antisocial personality disorder. Now for June and July, we're delving into the differences between bipolar 1 and bipolar 2. This month, instead of doing a straight recall question, we're going to do an application question where you apply the knowledge of these diagnoses to a client scenario. Bipolar 1. For bipolar 1, you need to have one thing, a manic episode. That's it. Bipolar 1 does not require a major depressive episode. With bipolar 1, you will see someone with a significantly elevated mood experiencing mania. They could also have depressive symptoms, but these are not required for a diagnosis of bipolar 1. Once there is a manic episode, it is bipolar 1. Bipolar 2. For bipolar 2 disorder, you need to have a hypomanic episode and at least one major depressive episode. There has to be a major depressive episode along with the hypomanic episode for a bipolar 2 diagnosis. When you are distinguishing between these two, remember that as soon as they have a manic phase, it's bipolar 1, even if they also have a major depressive episode. The one thing you need for bipolar 1 is a manic episode. A major depressive episode can also occur with a bipolar 1 diagnosis, but you must have the manic episode. For bipolar 2, you need to have two things, a hypomanic episode and a major depressive episode. What is the difference between mania and hypomania? First and foremost, it's important to note that a manic episode is more severe and typically longer in duration than a hypomanic episode. A manic episode must last a week or longer, and symptoms include feelings of heightened energy, creativity, and euphoria, talking a mile a minute, needing very little sleep, being hyperactive, feeling all-powerful, invincible, or destined for greatness. And during mania, people may go days without sleeping, spend well beyond their means, even going into debt, and may neglect duties and responsibilities in their life. Mania is severe enough that it interferes with daily functioning and can require hospitalization for stabilization or medication management. Hypomania is a milder form of mania lasting at least 4 days. It can still be marked by elation and hyperactivity, or it can even come across as intense irritability, but it's not at the same level as a full manic episode where people feel invincible, can't complete tasks of daily functioning, or require hospitalization for stabilization. A simple way to think about it is that if someone were hypomanic, you may notice their behaviors seem different or off, but if someone was manic, you would definitely know something was wrong. ASWB practice question. A social worker meets with a 30-year-old client who came to therapy after receiving an ultimatum from her spouse. The client reports experiencing periods of feeling on top of the world, followed by periods of severe depression. When the social worker inquires about what led to her spouse's ultimatum that she attend therapy, the client shares that last week she quit her job and maxed out her credit cards to start a new business venture that came to her in the middle of the night. The client shares that she hasn't slept in days, but feels like she can take on the world. What is the most likely diagnosis? A. Cyclothymic disorder, B. Bipolar 1, C. Bipolar 2, or D. ADHD. The correct answer is B. Bipolar 1. The symptoms being described indicate the client is experiencing a manic episode. The symptom severity is beyond that of a hypomanic episode, which allows us to rule out both cyclothymic disorder and bipolar II. Even though the client shares that she experiences periods of severe depression, remember that as soon as a manic episode is present, the diagnosis is bipolar I, even when there are also depressive symptoms present. The symptoms being described go beyond that of ADHD. Thanks so much for listening. Remember, if you're studying for your exam and looking for the best LMSW, LCSW, or MFT exam prep program, please visit our website at therapistdevelopmentcenter.com to sign up. With a 95% pass rate, we offer the best study system on the market to help you pass your exam with confidence. Here at TDC, we're with you until you pass.